Hello, welcome everyone, and Happy New Year. Thank you for joining us this evening for our discussion about COVID-19 vaccines. My name is Melanie Abdelnour. I am an adult living with CF, and I am so happy to be here with you tonight. Tonight, we look forward to hearing from a panel of experts about the recent emergency use FDA authorized COVID-19 vaccines and the implications they may have on our CF community. We have received over 500 questions from the community about the vaccines, like how safe and effective they are, and when people living with CF can get vaccinated. It is our hope that tonight's conversation will address these questions and many more. Please know that your questions guided the content of tonight's panel, so thank you to everyone who submitted questions in advance. If you haven't submitted a question yet, it's not too late. We will be answering as many questions as we can in a bit. But first, I want to give a shout out to our chat moderator, Lydia Sand, for helping us keep the chat going. It is not an easy job, so thank you, Lydia. And a few logistics before we get started. With regard to the chat box, you want to change the drop-down menu so that your messages go to all panelists and attendees. That way, everyone can see your comments. As I mentioned, we will have a good amount of time at the end of the town hall to take your questions live. So please feel free to type your questions at any time in the Q&A box, not the chat box. Our panelists will not be able to address individual or personal situations, so please try to phrase your questions in a way that is more broadly applicable. And while we won't be able to get to every question during tonight's event, the Foundation will be looking at all of the questions submitted to help inform updates for the COVID-19 FAQ, which is posted on cff.org. There will be a link to the FAQ in the chat. This event is also being recorded and will be posted on YouTube, so everyone watching tonight will receive an email with a link to the recording as well as to the COVID-19 FAQ. Before we dive into tonight's expert panel, please join me in welcoming Dr. Michael Boyle, the President and CEO of the Cystic Fibrosis Foundation, to provide us with a brief update on the impact COVID-19 has had on the CF community. Hello and welcome, Dr. Boyle.
Good evening, Mel. Thank you. We're so glad that you're our host tonight. So thank you for doing that. So hello, everyone, and Happy New Year. It's great to be together tonight. I hope you've had a healthy and a happy and a safe holiday season. You know, even with all the things that are going on around us, there are so many reasons to be hopeful as we enter this new year. And up at the top of that list is the recent FDA authorization of 2 COVID-19 vaccines. You know, the clinical studies of the vaccines have provided a great deal of information about the efficacy and safety of the vaccines. At the same time, we're continuing to learn, right? We thought this was the right time to bring everyone together to provide you with the latest information and resources and to answer your questions. So thank you for taking the time to be with us tonight. We have a great group of experts who are going to talk you through this, all right? You know, the vaccine efforts are starting to build some momentum. That last week, the foundation started by actually conducting a clinical care town hall with nearly 300 healthcare providers from around the country, representing all aspects of the CF care team to discuss the vaccines, answer their questions, and help them be ready to support you and your families. So, and just if there's any question about where we stand and where I stand on the importance of the vaccine, I can let you know that this past Monday, because I still see patients myself at Johns Hopkins, and I'm looking forward to being back in the hospital and in clinic as soon as possible, that I, along with the rest of the Johns Hopkins adult CF team, received my first dose of the COVID-19 vaccine, all part of the hospital's aggressive efforts to vaccinate healthcare workers so we can move as fast as possible to patients. I'm looking forward to that being the story for all of us as soon as possible. And what it's going to look like is what we're going to talk about tonight. Before we dive into our expert panel talking about the vaccines, I wanted to provide just a couple of updates, the latest information about COVID-19 and CF for your awareness. As some of you have seen, we actually had a very formal study published in the Journal of Cystic Fibrosis at the end of last year, which showed some promising results that show that in adults and children with CF, that COVID-19 pandemic hasn't affected the CF community as severely as we originally feared it might, right? That said, as the cases across the US have continued to rise, we've also seen an increase in cases among people with CF. As of just this week, there have been 799 cases of COVID-19 infection in people with CF in the United States. So about 2.6% of all people with CF in the United States have had COVID-19 at this point. This is still less than half the rate of the general population. 119 of those people, so not a big number, but some of those people have required hospitalization. There's been 3 deaths total, 1 very early on in CF, 2 other post-transplant. That has not, there have been no more deaths since very early on in the pandemic. While 1 diagnosis and certainly any death are way too many, overall these numbers actually, I think they attest to the great job that the CF community has been doing with basically being careful. But I think it also reminds us the importance of continuing to do this for these upcoming couple of months while we get over the hump here. So I just want to, before we get to the panel, I just want to say on behalf of all of us at the CF Foundation, I want to encourage you to continue to be vigilant. I want to assure you that we will continue to work our absolute hardest to serve you and your families. So we know there's no community stronger and more resilient than our CF community, but there is a light at the end of this pandemic tunnel, right? And we're going to get through this together. So now it's my pleasure to have Mel come back, kick off the panel discussion. As we're doing this, I just want to say how grateful we are to have each of the panelists on tonight and have them as part of Team CF. Not only are they absolute experts in their fields, but knowing them, I just know their hearts and how they're absolutely committed to the CF community. So Mel, please take over and lead the way.
Thank you, Dr. Boyle. And you're right, they are the best of the best, working tirelessly. So we are so grateful.
You're here.
Now allow me to introduce our esteemed panel. Please join me in welcoming Mary Dwight, the CF Foundation's Chief Policy and Advocacy Officer, and Dr. Al Faro, Vice President of Clinical Affairs. Mary and Al are joined by Dr. Christian Merlo, who serves as the CF Center Associate Director and Associate Professor of Medicine and Epidemiology, Pulmonary Care at Johns Hopkins. Thank you all for your time and expertise. I think without further ado, we should dive in. Dr. Faro, before we get too deep, could you please walk us through the 2 COVID-19 vaccines that have received emergency use authorizations from the FDA, as well as those that could be authorized very soon?
Yes, thank you, Mel. And Happy New Year, everyone. I'm so happy to see so many of you on. This is fantastic. So first and foremost, it's important to preface this that there is lack of data in people with CF. We do know, and we're going to talk about this later in the evening, we do know that some people with CF participated in some of these trials, but we do not have specific CF data. So a lot of what we'll be talking about will be the data of the entire study cohorts. So the other aspect of this that's important is that there isn't data in children as defined by people under 16 years of age. Pfizer did include some children 16 and 17, in pregnant women, or those who are immunocompromised, such as transplant recipients. Now, the studies, though, did include a very diverse and representative population in the United States in terms of racial mix, ethnic mix, as well as people who are at risk of having bad outcomes should they become infected with COVID, including people with diabetes, senior citizens, heart disease, lung disease. So that is why we do know that there were some people with CF in these trials. Now, the 2 vaccines that are presently available came through the emergency use authorization process at the FDA. This is a rigorous process that looked at phase 3 data as well as earlier and preclinical data to support these vaccines. I know they sound a little new because the platform that these 2, so the Pfizer and the Moderna, are based on is called mRNA, they're mRNA vaccines. And what that means is the genetic code in the RNA for a particular protein on the virus, and the protein that's picked is the one that probably all of you have seen by now on these pictures of the virus, is that spike protein, because that spike protein is what really allows the virus to invade the cells. And the mRNA is packaged in sort of this fat globule of lipids, as well as some chemicals to allow it to stabilize, because mRNA is very fragile. And that is one of the reasons, as you've probably all heard and are familiar with, these vaccines need to be kept cold. In fact, the Pfizer vaccine needs to be kept at minus 80 degrees. So these are fragile. The mRNA is fragile. It also has, and this is important, a poor half-life once it's in the cell. So I know people get nervous when they hear about genetic material, and certainly when you're injecting any sort of genetic material. It's important to note that the mRNA that goes into the cell so that the cell can now manufacture the protein that the immune system is going to react to and defend us from the virus once the immune system has seen this protein, it only lasts in the cell somewhere between 24 to 48 hours. So it's gone. It serves its purpose to get the cell to make antibodies, but it does not remain a long time in the cell. Then the others I want to point out real quickly are the two candidates that are closest to receiving emergency use authorization. The first one I'll talk about is Johnson & Johnson. And some of you may have heard that there is brand new data, in fact, just published this week in the New England Journal of Medicine, the results of the early phase study, so 1 to 2A, where they looked at about 800 people, and the early phase suggests that 90% of those who got the vaccine developed neutralizing antibodies. That is really very, very exciting. But even more exciting is they developed a T cell response. And why is that important? Why am I geeking out about that? Well, a T cell response suggests that you're developing memory, and memory suggests then longer term immunity. So this is really very exciting early data. The nice part about this, though, is because there's been so much invested in moving these vaccines rapidly. J&J is in a phase 3 trial, and we are looking forward to seeing results within the next couple of weeks. The other very exciting part about the Johnson & Johnson vaccine is that it's a single dose vaccine. So that could be a real game changer in availability. And then the last one I'll mention is the AstraZeneca, which, like the Johnson & Johnson, is an adenoviral vector vaccine. So these two are different than the mRNA vaccines of Moderna and Pfizer. But again, it's the adenoviral vector introduces the DNA, the genetic material, so that the protein is then made in our cells, and then the immune system reacts to the spike protein. And again, it's the spike protein.
I think that the most pressing question is, are these vaccines safe?
Yes, so that's and rightfully so, right? Always first principle is do no harm first. And the process, as I mentioned, of receiving an EUA is rigorous and based on scientific evidence. And these studies, both of the ones that have been authorized, both Moderna and Pfizer, went through phase 3 trials with tens of thousands of patients. And in terms of adverse effects, really what was seen was what would be expected, mostly in terms of local reactions, as well as perhaps some fever, but muscle aches, and local site reactions. And this is based on tens of thousands. And now, in point of fact, 11 million people in the United States have received both of these vaccines. I just want to point out, I know people are nervous because of the speed of development, but the speed of development is really attributable to what happens when humans unite and work together. Unfortunately, it took a pandemic, but more money, more researchers, more attention have been given to the development of these vaccines than anything we've seen. And these truly are medical breakthroughs. And I wouldn't be surprised if they're not candidates for Nobel Prize.
I agree. That's why I love seeing pictures of my healthcare friends getting vaccines online, because it's just an image of community plus science equals hope. So I love that. Dr. Farrow, one more question. There have been 2 vaccines that have been given emergency use authorization. How do we know that these 2 vaccines are effective?
So again, we have seen study results. They've been published. Data from the Pfizer vaccine showed 95% efficacy 7 days after the second dose. So again, remember, both of these require 2 doses. So in other words, in the study, there were 162 cases of COVID confirmed in the placebo group, and only 8 in those that received the Pfizer. And similarly for the Moderna vaccine, which showed 94% efficacy, at least 14 days after the second dose, there were 185 cases of COVID in the placebo group and only 11 in the vaccine group. So this is remarkable efficacy for a vaccine. Very few vaccines have this high of an efficacy.
Well, that gives me a lot of hope, that's for sure. Dr. Merlo, I'm going to turn it over to you. You've had some personal experience with the vaccine, which I would love for you to share, but also I know a lot of people in the community are hesitant to be vaccinated. Could you talk a little bit about vaccine hesitancy?
Sure. Thank you so much, Mel. I've just been watching this chat. It's such a whirlwind of information out there. I'm getting dizzy seeing some of patients that I've taken care of. So I'll give a shout out for everyone out there. I hear you. Everyone's hesitant about this probably because of the accelerated development of this. And what's interesting is I texted my parents earlier today to ask them how they felt when they had me get vaccinated for smallpox, because I was one of the last cohorts of children to get smallpox vaccination in the United States, and I still have a giant scar on my left shoulder for that. My kids still ask about that, and I'm just going to read you what my mom said to me earlier, if I can find it. Here it is. She said, "We both felt like this was necessary to keep you safe and healthy. We were never hesitant when it comes to vaccines, and no fear at all. We wanted to protect you, our baby boy." I think we're lucky right now. We're fortunate that we have 2 highly effective as. Is there something else I can help with? Oh, sorry, Siri. I think we're very important. That always happens on Zoom. It's just the nature of things right now. As Dr. Farrow said, we are very lucky right now that we have 2 highly effective vaccinations out there. The side effects, which I'm sure we're going to talk about, there are some side effects out there. And those are similar to those of other vaccinations, maybe a little bit more. We don't know everything there is about the long-term effects of these vaccinations, but we're beginning to learn the long-term effects of COVID, and the effects of the vaccination are nothing compared to the long-term effects that we see in patients who get infected with COVID. And that's really what I want to highlight right now, that yes, we are all hesitant. And I'd take my shirt off, show you my scar. My parents, I'm sure that they were very, very, very hesitant. My mom said this by text, but I got a giant scar on my arm. When I was an infant, it was even bigger, but they did it to eradicate the smallpox from the world. And we have a chance right now to do that with this virus. So get it, you're hesitant. I get it, we're all hesitant. But when I got my card, when I got my sign up, I went and did it, and this is my card right here. I've gotten 2 vaccinations, and I would recommend it for everyone.
Well, thank you for sharing your personal story with getting the vaccines and your childhood story as well. I think what you said that resonates the most with me is comparing the long-term effects that catching COVID could have compared to the vaccines. So I think that is so poignant. And you did mention that there can be some side effects. Do you think you could elaborate a little on that?
Sure, I can certainly talk about the side effects that were described in the 2 New England Journal studies. And there were some side effects associated with these vaccinations, both the Pfizer and Moderna. And I think we would be remiss without talking about this to a panel of patients, because I don't want to just say that there are no side effects associated with it. A significant proportion of patients had fever or elevated temperature, soreness at the area of the injection, fatigue, myalgias, so just feeling bad, joint pains. Some patients developed nausea, and some patients developed chills afterwards. I can say this right now that personally, I did have night sweats and chills after my first and second injection, but it is nothing compared to what I would want myself or any one of my loved ones in my life to go through, and to have COVID-19. So yes, there are side effects, but the virus and my experience and all the things that are involved with that in its aftermath are way worse.
Thank you. Dr. Murillo, one more question for you. I know it was in the news a little bit this week, but do we know how long a vaccine will protect us against COVID-19? $1 million question.
I thought I was off the hook there, but I guess not. So recently, and I'm not sure we know entirely here, but recently there are some reports out there that at least the Moderna vaccine will offer protection for up to a year. It's kind of hard to really get into the nitty-gritty details of how that is determined right now, because there aren't that many people that have had the vaccination for that amount of time. So I think it's an extrapolated estimation. But this is actually very, very good news, and it coincides with the data that is emerging for patients who have had COVID, that there will be protection for a prolonged amount of time. What that amount of time is, we're not completely sure, but this is actually very, very encouraging news that it may last for a year or more. So I think these are the things that Dr. Boyle was talking about, the things that we should be happy about and smile and look forward to in 2021.
Agreed. And Dr. Farrow, question for you. I know many of us have seen also that there are new variants of COVID-19. Do you know, will we need to develop more vaccines for those new strains?
Yeah, so Mel, this is a great question, and I know that it's in the press a lot. One thing we all need to acknowledge is that viruses change over time, and most changes actually don't result in a worsening of the virus. Sometimes it may actually weaken the virus. So it's important to know that the virus has actually been mutating. In fact, even before we even knew of this virus in the United States, if you guys remember early on, the Wuhan strain, but then in point of fact, what we had here was the Italian virus or the Italian strain of the virus. So it's been mutating since early on. There is concern of this latest variant coming out of the United Kingdom in that it does appear to be more transmissible. So in a sense, more contagious. There's increased infectivity. And the mutation does sit on the spike protein. It has been tested to the Pfizer vaccines we have presently, and they are still effective against this. There is also a variant that's now come out of South Africa that also impacts the spike protein. I think it's important to also note that these vaccines, even though they're targeting the spike protein, they target many areas on that spike protein. So it would require many different changes to the spike protein for the vaccine to become ineffective. At the same time, could there be a point one day where the virus is mutated such that the present vaccine isn't effective? It is possible. It is important, though, then that we have a very strong public health system to be aware if there are such dramatic changes and do all the public health measures to control that until we can change the vaccine.
Thank you, Dr. Farrow. Mary, I'm going to come to you next. When will people with CF be able to get the COVID-19 vaccine? I know you have been working tirelessly to figure this out.
Hey, Mel. Yes, and I see a whole lot of questions on that in the chat, as well as a whole lot of friends. So it's great to be with you all tonight. So honestly, there isn't a straightforward answer for this one. And we well hear and currently are reading your frustration. Many of you have been enormously taxed in this pandemic, and we know that you're eager to get past the fear and get back into your life. So throughout the pandemic, we've been engaging with decision makers at the federal and state level to ensure that they understand the dangers of respiratory infections for people with CF every day, including in this pandemic. And we're pleased to see that people with CF should be able to get the vaccine along with other people who have high risk medical conditions. But the reality, and as we're seeing in real time, it may take some time. It's important to note, and I think Al already spoke to this, that we're still in the early days of vaccine availability. And it's really a supply and demand issue right now. Supplies are still low. So I think it might be helpful to take a moment to walk through the recommended allocation frameworks for these two authorized vaccines. As you may know, the CDC has an advisory committee on immunization practices, ACIP, and it makes recommendations about vaccines in the US all the time. And it also has really focused on these COVID vaccines and who should receive priority access for them. Last month, the ACIP issued allocation recommendations regarding the COVID vaccines that have been authorized, the ones from Pfizer and Moderna that we've been speaking about tonight. And under those current recommendations, people who are at the greatest risk of exposure and transmission of COVID-19 will be first in line for the vaccine. So that includes, as we've been seeing in the media and even in the chat, as people share, people who work in healthcare settings and live and work in long-term care facilities. Some essential workers like teachers or police officers and people over 75 are recommended to be the next group to receive the vaccine. And the age of 75 and older, they've been included in this prioritized group because they have the highest COVID-19 mortality rates out of any age group. They account for 6 out of 10 COVID deaths in the US right now. So following these initial two groups, vaccines are expected to be available for anyone 16 and older who have underlying health conditions that might put them at an increased risk for serious complications from COVID, including CF. The CDC has directly called out some conditions that are known to increase risk, like cancer or type 2 diabetes, or I saw in the chat smoking. However, they've also noted that this list is not exhaustive and that they really encourage provider discretion to identify patients for prioritization based on personal risk factors. And you also see that they list things like CF that might include risk. Part of that is because we're a rare disease and our numbers are small. So as you heard from Mike, about a little under 800 people with CF, a small number of people in the total population that has gotten COVID, that's where you see that might come in. The CDC's recommendations, and I think this is important too, are meant to be fluid. and not restrictive. And they're really intended to balance maximizing getting vaccines into arms while being mindful of priority groups who are most at risk and those professionals who are most essential to our nation's health care and getting the economy to reopen. So it's a balancing act. So now let's shift over to states, which has really been in the news a lot too. So again, these recommendations from the CDC are guidelines and they're not binding. While states are encouraged to follow these recommendations, ultimately the final decision on how a vaccine will be distributed is up to each individual state. And as we've already seen in the first few weeks of vaccinations, there are significant differences in how states are prioritizing different populations. So for example, in Texas and Florida, they started vaccinating everyone 65 and older, whereas California, there's a statewide framework, but every county has its own plan and they may prioritize groups differently. So there are a lot of different frameworks out there. And also, I think it's really important to note that the vaccine rollout has been going slowly in these initial weeks for multiple reasons, including logistical issues, resource constraints, and at the state and local level, as well as initial recommendations to hold on to doses to ensure that those vaccinated have access to their required second dose. That second dose for these two vaccines is really important. So in addition to a variety of approaches in different states, the recommendations for distributing vaccines are in flux. Just this week, the Trump administration deviated from those ACIP recommendations I spoke about and urged states to prioritize everyone over 65 and anyone with a high-risk medical condition. And it really remains to be seen how states will incorporate this guidance into their existing frameworks. We also know that the Biden administration, in fact, just this evening, announced some more of their recommendations and their frameworks. And rest assured, we are tracking that very closely and will continue to do so. It goes into effect. So I want to emphasize one thing. Allocation frameworks that I just walked through, these alone won't get vaccines into the arms of people with CF. These frameworks have to be accompanied by support and resources for effective distribution at the state and local level. It's the combination of all of these factors, changes to federal and state frameworks, financial support for states and localities, individual institution decisions, and the speed of vaccine manufacturing that will all affect when people with CF receive a vaccine. Our hope, let's be clear, is that this speed will continue to increase, particularly as more vaccines become available. And I want to say this process is far from perfect. And to be quite frank, the rollout of the vaccine has been confusing and complicated. What I want to assure everyone is that the foundation has and continues to do everything that we can to advocate on behalf of people with CF to ensure you receive priority access to the vaccines. People with CF need a vaccine distribution strategy that is aggressive, predictable, and adheres to science and medicine. So let me assure you, we will continue to monitor this very closely, to share information with decision makers and about the needs of our community, to ensure that states have the adequate resources and support they need to get you all vaccinated as swiftly as possible, and to continue to share information with you.
I know how hard you and your team are working, Mary. So on behalf of the community, I thank you very much. I also just have to interject that I completely understand why so many of us are feeling anxious about getting the vaccine. I think much of the community has been living in fear for almost a year now, and getting a vaccine would alleviate some of that fear. For me personally, it helped me to shift my perspective from a me perspective to a we perspective. And the more I thought about it, the more I realized, yes, I would love a vaccine, but I actually do want those on the front lines, like our healthcare providers, our teachers, our care teams who take care of us. I do want them to have the vaccine first, because the vaccine will have a bigger impact if it protects those more exposed. I think that we have come so far and we're so close, we can hang in there till those vaccines make it to us. I also understand the trepidation about the vaccine and how uncomfortably fast the research moved. But personally, when I am offered any of the vaccines, I am going to jump on that train, because not only do I want to live with less fear, but I want to do my part to help slow the pandemic as well. Dr. Merlo, for those of us who do want the vaccine, What will the process be like to get vaccinated, and will the care centers offer them?
Thanks, Mel. That's an incredibly difficult question to answer right now, right? And I think Mary Dwight hit the nail on the head with this, that every state is doing things differently. And I'm in Baltimore at Johns Hopkins. We see patients from New Jersey, Delaware, Pennsylvania, Virginia, North Carolina, all over the country, West Virginia and Maryland. And each state is doing things differently. I would encourage all of you to be in contact with your care centers, because each state has a different distribution policy. And as Mary Dwight said, this policy is fluid. It's changing sometimes hour to hour. We've just gotten messages maybe a few hours ago on my Hopkins email saying that the Maryland distribution is now in flux, changing to include this population. I think that we look forward to the Biden administration to really roll these things out in an effective way. And I wish I had a better answer for you. I really do. I wish I could say, yes, everyone's going to get it in X amount of time. Everyone will be offered a vaccination. I just don't have a time period for you. And I think we need to be patient. And the one thing I do want to say is I am so thankful for the CF population and for my patients in showing me patience. Most of you have lived with the 6-foot rule and masks for so many years, and the rest of the world has had to do this for 10 months, and we're going crazy. But you all have done that for your lives, and I think if the rest of the world had followed your lead, we wouldn't be in this mess right now. So I really want to thank you. And I want to ask for your patience for just a little bit longer.
Well, thank you for acknowledging our good infection protocols. I will accept that on behalf of the community. I think we were pretty great at it also. This hour is just flying by at warp speed. So I just want to jump into the next question, Dr. Merlo. Can people get vaccinated if they've had an organ transplant?
Okay, I thought I was off the hook. Yeah,
Nope.
so
Yeah. Sorry.
Am I back on?
You're on.
Yes. Yeah. So the CDC and the International Society for Transplantation do recommend patients who have had solid organ transplants to receive a vaccination. The CDC considers folks who have had solid organ transplants, that includes lung transplant, heart transplant, liver, kidney, others, as immunocompromised patients who are at risk for severe COVID-19, and does recommend vaccination for those folks. I wish I had answers, and I'm just going to grab the bull by the horns here. I wish I had answers about whether or not there will be an antibody response to that vaccination. And I think more to come on that. And there is a national effort to actually study that. So I would encourage those who have had organ transplants, who are offered a vaccination, who take that vaccination, to, and I can put this in the chat, to consider participation, sorry about that, participation in a research trial that will follow antibody response after the vaccination. And it's a website, you can go onto it and they'll send you stuff, and you can, it's all done free, and they give you the values back over time. And the website is transplantvaccine.org, and I can put that into the chat. But for those out there who have had organ transplants who would like to participate in this, I'd encourage your participation. We'd be very thankful.
Thank you, Dr. Merlo. Dr. Farrow, when can children get vaccinated?
Yeah, thanks, Mel. You know, as a pediatrician, I'm excited to see how many people really want to hear that on the chat about the kids. So again, unfortunately, the Moderna vaccine was studied in people 18 and older. The Pfizer vaccine, as I mentioned, had some kids 16 and 17. Pfizer is now enrolling, and we should have data within a few months, children 12 through 17. Moderna has plans to start a trial in children 12 to 17 within the next couple of months. I think a good analogy, and one our community would understand, is when you think about how clinical trials for CFTR modulators have played out and how they've been advancing to younger and younger ages. And the same safety concerns around exposing children without having a lot of data plays into this as it did for the CFTR modulators. So the hope is that by the summertime, we'll be able, if it's safe and effective, have a emergency use authorization for kids 12 and older at least.
Thank you for that. And Dr. Merlo, what about pregnant women or those breastfeeding?
Thanks, Mel. That again is a very difficult question, because usually women who are pregnant or breastfeeding are included in trials like that, and that's similar. That's what happened in the Pfizer and the Moderna trials, that pregnant and breastfeeding women were not included. The CDC does recommend for pregnant women, and that would include pregnant women with CF or breastfeeding women with CF to be vaccinated. And this recommendation is also shared by the American College of Obstetricians and Gynecologists, as well as the Society for Maternal Fetal Medicine. So 3 societies coming together, not that often that this happens, but 3 societies coming together with a universal recommendation for both vaccination for both pregnancy and breastfeeding.
Thank you so much. Mary, this is a popular question a lot of people are asking in the chat. What about the people who live in our household with us? Will they be getting the vaccine at the same time?
Yeah, and unfortunately, the answer is no right now. As I said, the vaccines are in short supply, so that's why the recommendations are out there, because we want a phased approach to really prioritize higher needs. So until the supply becomes more available and we're able to vaccinate people at a much higher rate, family members and households will probably not be given priority for a vaccine unless they qualify on their own. So for occupation, if they're a teacher, or age, or another underlying condition. You're muted.
Thank you, guys. This was so much information to process, but it was so helpful. We're going to transition to our live questions now, which there have been a ton. The first question is for Dr. Farrow. Does the vaccine interact with any other medications, like highly effective modulators, for example?
Yeah, there's no evidence to believe it would. Again, these are mRNA vaccines. The mRNA disappears fairly quickly, and basically you have this immune response to the protein. So there's no reason to believe there would be a drug-drug interaction.
Thank you. Mary, you're going to get the second question. What is the CF Foundation doing to ensure that people with CF are in the early vaccine group? I know you sort of touched on this a little bit, but could you elaborate at all?
Sure. So since the discussions on vaccine allocation began early this summer, the foundation has been engaging every opportunity we have. And you can see all of this on the website, cff.org. You can read all of these letters that I'm going to mention. So the goal has been to educate decision makers about cystic fibrosis, again, in general, and then the specific impacts of COVID on the CF community that we're learning. through the registry and other monitoring tools. So we've submitted comments to the CDC's ACIP numerous times at every phase of their decision making, and also the National Academies of Medicine, which was another entity that was involved in the allocation frameworks. Specifically, we asked decision makers to prioritize access for people with cystic fibrosis and those in general at increased risk for serious illness. We've asked them to, as I mentioned before, recognize the limitations of rare diseases like CF and our ability to really quantify how COVID impacts people with CF. And also particularly recognize that some people with CF, such as those with advanced lung disease or post-transplant, are even more particularly vulnerable. So to really prioritize them and to leverage our expertise as they implemented these frameworks. I also want to note that we've been engaging with all 50 states. You can also see those letters on cff.org, and also beginning to engage with the incoming Biden administration as that transition from administrations occurs next week. So we're looking at vaccine allocation, but also really importantly, we're looking at those resources and support that both the federal government and states can offer so that we can have all the pieces of the puzzle to get vaccines into arms there for us.
Thank you. Dr. Farrow, this is an important question, I think. Can people who get the vaccine still spread COVID-19?
Yeah, that's a great question. The short answer is we don't really know yet. We know these vaccines are very effective in preventing disease. We don't know if people after the vaccine may potentially be asymptomatic carriers and have the potential to infect others. There's some early data from the Moderna vaccine that would suggest not, but that's still preliminary. I would say that most likely, however, those who are vaccinated, if they are transmitting virus, probably aren't transmitting virus the same way as unvaccinated because the viral loads are going to be lower. The virus itself is going to be kind of limpy. So it probably won't be quite as infective, even if it does.
And Dr. Farrow, one more question. Do you know of any people with CF who have been in any of the clinical trials?
No, I do not. Again, for instance, the Pfizer data, they had people with lung disease, and they actually point out that one of those lung diseases was CF. But I have not been able to find out what the number of people with CF in the study was, or specific CF results.
And one more question for you, Dr. Farrow. How will people know when they're eligible to get vaccinated?
I'm sorry, how will people know when they're eligible?
Yes. Mary, I don't know if you want to tackle that one also.
Yeah, that's, right now, as Mary's pointed out, we sort of have these recommendations from the CDC and the ACIP in terms of this tiered system. Again, each state is determining how they define those tiers and then their own system for how to make people aware of when they fall into the tier that vaccine is available for them. But Mary may want to expand on
No,
that.
I would echo it. I think it's unfortunately, it's varying widely state to state and even locality in some instances. So I would encourage you to monitor the news. They've been really good about covering specifics within states. I see there's so many questions about what is it like in California or Nevada or Florida, and it's going to be hard for us to answer that here. So I think just stay abreast. It is changing very rapidly. Even this week, there have been changes. So stay on top of it and see what's going on in your area.
And be in contact with your care center. That's the key here, because we, as Mary just said, we're hearing things minute to minute right now.
Dr. Merlo, I'm going to stick with you for the next question. What can people living with CF and their families continue to do after they get vaccinated? What precautions should they still continue to take?
Yeah, that's a great question. I was watching the chat and I saw that someone said that I sound like Jack Tripper, which I thought I would comment on, because one Halloween I was Jack Tripper. We dressed up as Three's Company. And so I just thought I'd give a shout out to whoever that was. That was about 70 chats ago. But we are paying attention to you. So I think it's very important. And just as I think Dr. Farrow had commented on this, we really don't know whether or not the vaccination will prevent spread. We do know that it is effective in preventing disease, but can someone still have a small infection and spread it to another person? There are some data out there that suggests that that's not the case, but I don't think that is completely known yet. So even with the vaccination, until we know otherwise, social distancing, the 6-foot rule, the masking, the simple things that our parents told us when we were kids, right? I mean, just wash your hands, don't touch your face, stay away from people that are sick. I think that is still going to have to, stay in the fight, right? So until we know otherwise, masks, 6 feet, wash your hands, don't touch your face, get a vaccine. And I think, that's something that Dr. Fauci has said for a long time, and I don't think we would disagree with that.
And Dr. Merlo, follow-up question. If you've already had COVID-19, should you still get vaccinated?
That's also a very, very good question. And the short answer is probably yes. The long answer is at what time should you get vaccinated? I think what we're hearing is, actually, I don't know the answer to that. I don't know the answer to when someone should be vaccinated. I've heard varying lengths of time, but the answer is yes, you should be vaccinated, but more to come on the length of time to wait until vaccination.
Thank you for that. Dr. Farrow, when patients do get access for the vaccine, will they have a choice of which one they receive?
No, unfortunately, again, because it is in such short supply, the distribution is such that whatever the institution has, that's the vaccine that's available. Right now, again, between these two mRNA vaccines, they are both incredibly effective. And so it really wouldn't matter very much in terms of which one you get. And I just want to point out, just to the previous question, the CDC has recommended that you be asymptomatic or out of quarantine if you were asymptomatic with the disease before getting a COVID vaccine. And if you got the monoclonal antibody, you need to wait 90 days before getting vaccinated.
That's really good to know. Do you, Dr. Farrow, know if any of the COVID vaccine information will be captured on the CF registry?
We are going to be asking our care centers to enter data around dates of both vaccinations, the first dose and the second dose, as well as which manufacturer. So yes, and I'm forgetting one. There was another piece of data that is escaping me right now, but we will be collecting data on the vaccine.
I love when we find out that doctors are humans and not robots. That's perfectly fine. Dr. Merlo, is there a benefit in waiting for the other vaccines once approved, like the one from Johnson & Johnson or AstraZeneca?
I think I would agree with Dr. Farrow right now, and probably others out there, that if you have the opportunity to get a vaccination, that these vaccines are both highly effective, at least the ones that are available right now, that it would not make sense to wait for any one or the other, or choose between them.
And Dr. Farrow, could you get the COVID vaccine at the same time as another vaccine like the flu shot?
That's a great question. I actually, it probably doesn't matter. If you're there and you've not been vaccinated against influenza, you probably should go ahead and proceed and get it. And then if I know people are asking a lot about the Novavax, maybe just to chime in real quick, it's a different platform. And it's where you're actually being injected with the protein. It comes in a nanoparticle, but it's not genetic material, but the actual protein that then your immune system reacts to. And again, it's the spike protein.
Thank you for that. I'm going to open this up to all three of you. Is there any advice that you would share as we navigate this time? Any last words of advice?
Well, I guess I would start.
Yeah, go ahead.
I think what was said earlier, and I think it was Mary who was, and Dr. Merlot, around being patient. Right now we're still in the midst of this pandemic, and we all know it's been way too long for all of us. And for some of us who are at greater risk, even much longer in terms of the anxiety and the stress that we have around this disease. But there is a light at the end of the tunnel. I would be actually very hopeful. One, as we've said many times, we have these two very effective vaccines, and the production is being ramped up. And importantly, if what we expect happens with the AstraZeneca vaccine as well as the Johnson & Johnson vaccine, within a couple of months, we may have tens of millions of more doses out and available to get into people's arms, as well as now, hopefully, we're going to have a system where there'll be a more organized approach, a more centralized approach to distributing the vaccine as well. So I would be very hopeful that over the next several months, we're going to see a very rapid ramp up in people getting vaccine into arms.
Yeah, I would just pile on to that. I think, as we said, this is very early days in the vaccine. They were just approved in December. So we're still within about a month of these things being approved, and everything is ramping up. And so if you think about it, even within the context of the pandemic, it's sort of the equivalent of testing. And you remember in those early days, it was next to impossible to know what test to have, where to get it, was it available? And now we have testing in a lot of places. So while I certainly hear the frustration, and I think all of us share in the frustration and want this thing to be over, I completely agree with Al that we see the light at the end of the tunnel, and I think things will smooth out as we see more manufacturing, better resources. So my two things are, I'm going to pull up my favorite mask again: stay in the fight. We just have a little longer, stay in it. And also know that the foundation is fighting right along with you. We are closely monitoring this. We have an amazing team doing that, and we will take advantage of every opportunity to make sure that we're advocating for the needs of this unique and amazing community.
Thank you for that. This hour went by so fast. I just want to open the floor to the three of you to see if you have any final thoughts. Dr. Merlot, I will start with you and then go to Mary and then Dr.
Farrow. This has been an incredibly tough year for everyone. I feel like I've forgotten a lot of medicine, and all I know is how to take care of COVID patients right now. I want to see you in the clinic, I do, but only when it's safe. And I don't want to see you in the hospital because of COVID. And all of you have been, I said this before, have been fantastic examples of how to avoid getting or passing or transmitting infections from person to person. So just please keep it up, because as Mary Dwight and Dr. Farrow said, there is a light at the end of the tunnel. It was long. We don't really know how long it is right now, but it's getting shorter and shorter and shorter. So please hang in there.
Mary, any final thoughts?
I echo what Al and Christian just said, and Mel, to thank you for, and the whole community. You guys remain inspiring and impressive. So hang in there. We're all hanging in there together. We'll get through it. We see the end.
Dr. Farrow, you get the final word.
Yeah, and actually the word I was thinking was the one that Mary just said, which is together. What's always impressed me about this community is how we address issues, overcome concerns and barriers, and we do it together. We support each other and we think together and we find ways to address the problems. You know, it's maintain the measures that we know are important, that our community is really good at, and continue to do it. And the vaccine is not that far away. So, and Mel, thank you so much for doing such a wonderful job moderating.
Oh, thank you. It was such an honor to be amongst such brilliance. But not only are you guys super smart, I think anyone who watched this hour can feel your empathy and your compassion and all that you do for the community. So thank you all so much as well. Sadly, you guys, I'm afraid that's all the time we have for tonight. While we weren't able to get to all of your questions, please know that the Foundation will regularly be updating the COVID-19 FAQ on cff.org with answers to the community's top questions. A link to that FAQ is in the chat and will also be emailed to all event attendees and registrants tomorrow, along with a link of the recording, should you wish to watch this again or share it with somebody else. The Foundation also plans to translate tonight's meeting in Spanish and will post the recording to the Foundation's YouTube channel on cff.org. I'd also like to mention that tomorrow, Friday, January 15th at 2 p.m. Eastern Time, the Foundation is co-hosting a COVID-19 vaccines webinar with the National Organizations for Rare Disorders, the ALS Association, and the Muscular Dystrophy Association. Leaders from the FDA and the CDC will discuss COVID-19 vaccines with the rare disease community. A link to register for that will also be posted in the chat. It is with such sincere gratitude that I thank you, Dr. Merlo, Dr. Farrow, and Mary for speaking with us tonight. I want to thank the hardworking team behind this at the Foundation who made this town hall possible. I want to thank everybody who tuned in. This was all for you. And I hope that everyone has a happy and healthy new year. 2020 was tough, but we got through it. And I want everybody to remember that we are in this together. Stay well, everyone.